My name is Chris Picardo. I'm a partner at Madrona. I spend a bunch of my time focused on the intersections of innovation, which is really the worlds of machine learning and software combining with biology, life sciences, and healthcare. And so it's really fun for me to get to switch us gears for a second for the next hour or so with the next set of speakers and to talk about a couple of companies and approaches in this exact space. So first up, I'm delighted to introduce my partner, Jon Turow, and Yinhan Liu, who's the CTO and co-founder of Birch AI, to talk about applying generative models to complex healthcare problems.
Well, thanks everybody for sticking around late in the day. This should be a really fun conversation. As Yinhan and I have gotten to know one another and have gotten to know Birch AI, what I've seen is that here's a company that's been using the technology of generative AI for a really important set of problems before folks were talking about generative AI. And they're doing it in some ways that sort of don't match the conventional wisdom. And that's exciting. There's a lot to learn from it. So thank you so much, Yinhan, for taking the time today as well.
Sure.
So let's level set. What is Birch AI?
Sure. So Birch AI is like handling call centers. So we are able to reduce the average call time, handle time by up to 35%, which is a big number. So we started doing by automating the after call work, which means like the agents don't need to worry about documentations. They only need to focus on talking to customers. Birch is doing all the things for them, including writing summaries, classifying the calls, fill out forms, writing follow-up emails if necessary. So those were done by our in-house generative AI models. Right now, we're also adding on-call support. So we give recommendations to the agents to what to say based on what customers have said, and also give them a reminder of like sentiment speeding up or slowing down or volume, those kind of informations. So we have all of our models in-house, including ASR model, summarization, task tracking, recommendation, sentiment, and entity extractions.
Got it. So here we are in a call center, and we're tracking medical conversations. And after call, we've got to do this summary. So can you explain a bit about, what is the core problem that you're going to solve with this? And,
sure, absolutely. So let's start with an example. This is a very detailed example. This is one of our use case. A little bit background. So the agents here are the cardiologist from payer side, who are our customer. And then the customer is the cardiologist from provider side. So this call is about deciding if this treatment is medical necessary for the patient, should be approved or not. So this is like 6 minutes call, and after that, one of the summaries is was generated by Birch summarization API, and one of the summary was generated by human, the cardiologist. Just make a guess which one was written by Birch and which one was written by human. I will give 5 seconds. B is for Birch. So you can see the quantity. This is very, like a very hard call because those terms were medical terms. So this is the value here. Those cardiologists are getting paid $5 per minute. And on average, it takes them 4 minutes to write one summary. So this is $20 per summary. And we are able to generate such a summary in front of the cardiologist within 6 seconds after the call. So that's our model, which is a cost-saving model. We also have other use cases, like we got approached by customers in travel and in retail. Like their agents are not as expensive as cardiologists, but they are suffering from summary quantity issue. Some agents are really tired, they don't want to write summaries. So their PMs really want to know what has happened in the call and what they can do to improve the quantity of the products. So in this case, our API is able to write in summaries with the same quantity for every single call. And also we have on-call support, which is giving recommendations for agents to decide what to say. And those like can shorten the training time and the onboarding time for new agents.
So if I connect the dot, I can think about the quality of the summary. Yes, if I can do high quality summaries at speed, that helps me save cost, but ultimately helps me probably deliver more care, better care, fewer mistakes, fewer wrong prescriptions, things like this.
Yes, definitely.
You know, Charles in the previous session was talking to this group about AIs and humans working together.
Yes.
Would you apply that paradigm to Birch as well?
Yeah, definitely. So we heard a lot of feedbacks from our agents who say like, I really enjoy having those clinical calls, but I hate writing things up. And it's taking me so much time to do spellings and those kind of things. So they love to use us because they want to focus on the customer to solve the problem they are good at instead of doing documentations.
As an agent, would the experience be that a summary kind of pops up and I can then edit?
Yeah, so it's our customer choice if they want their agent to edit the summary or not. So for those healthcare ones, right now the solution is 6 seconds after call, they see the summary, they took it a little bit or maybe good enough to go, and then it's going to their CRM. They will click, they decide, okay, this is ready to go to the CRM.
And what has the telemetry been? Do customers tend to edit? Do they edit more in the early days? What is the sort of trust curve like?
Yeah, it's definitely less and less edits because at the beginning they taking them more to read the summaries, okay, if it's good enough. And as time goes, they found the pattern of machine. Machine always make the same type of mistakes, and so they just get it and edit. And after 2 months, we are able to understand, okay, machine always making these mistakes. And we train a new model and then deploy in the production, then that mistake disappear. So it's getting less and less edit.
Do your medical customers, are they interested to know about the technical guts of how Birch works? Do they want to know about the AI models you're using in the architectures, or is it really sold based on outcomes and performance?
Good question. So we have both type of customers. For example, one of our customers is a medical device customer. They have to write summaries for each call, which is required by FDA. They need to report it to the FDA. For them, they only care about how much money they can save by using us per call because their core business is doing those hardwares. And they want to focus on that. We also see customers a big, really big enterprise customers. They have tons of money going into their innovation center. So they want to do it by themselves. The way for us to get into those customers is you can try our API without any fine-tune. We have our foundation models. Just try it without any fine-tune, and it turns out it's even better than their fine-tuned model because we solved a lot of problems which was really hard to be solved by open source foundation models. So they got surprised, and then they ask us a lot of questions about how did you solve those questions, those problems, and then finally they have to accept the truth. It's people who have been working on this for a really long time usually are doing a better job so they got a chance to focus on their core business.
Backing up a little bit, there's a hint that you just gave there, and I think this audience will be interested in the larger story. Can you talk about innovating as a startup in the medical space? This is so important, but the sensitivity and the access of the data is restricted, and the sensitivity of the outputs is very high. We don't want to deliver the wrong medicine to somebody or give them the wrong care. So can you talk about the challenges and what you've learned about innovating in medical?
Yeah, definitely. There's always trust issue. That's really the hardest thing for startup to get into. So actually we start we had tons of conversations for product market fit before we decide what to do. So during those conversations we learn, okay, medical is definitely a hard vertical to get into, especially for AI, because people have doubts about AI. If it's making mistakes, that's gonna be huge mistakes. So the recall has to be 100% accurate. So in those cases, so we found a way for our model to coexist with those medical professionals. So for example, this is one of the example here. And then, as John said, the data is really highly sensitive. So the security has to be there. And it's taking us like from the first conversation to the day we got the first batch of data from our first customer, it's taking 10 months. So during that 10 months, we didn't only wait. We spent a lot of effort to build our internal foundation models. So we found that the stronger foundation model we build, the less training data we need, and the less concern will be raised by the customer. So within a really strong foundation model, we are able to fine-tune only on like couple hundred to couple thousand training data to get like result like this. And also there are another group of customers, like the foundation model is ready to go. It doesn't need any fine-tune. So what we can do, like while we are waiting for those slow like data transfer, we work on our foundation models, and that can shorten those like deploy time by 6 months to 12 months.
Okay. So we've mentioned foundation models a couple times, and I think it's really interesting for this group. Do you use GPT-3?
No, we don't. So there are a couple reasons for that. The first reason is we are handling those really highly sensitive data. So it sounds a little bit crazy, at least to me, for our customer to allow the data leaving our infra without any encryption to send into another instance. That sounds really crazy. So we have to have our model internally. And then it has to sit in our infra. Nothing can leave our infra. So even the ASR speech-to-text model, we have our own model. So this is one of the most important reasons. And there are other reasons. Like, for example, this model is 400 times smaller than GPT-3. GPT-3 can only handle QPS-1. We are able to handle QPS up to 10K.
Is that queries per second?
Yes, yes. So we are able to handle 8 million calls per day, easily scale up. All the models are feasible. And this is actually the largest model we use. We have smaller models to do different things. So our philosophy is simple. It's like we don't try to use one giant model to do everything. We use small models to do different things. So we have ASR model, we have sentiment model, we have recommendation model, summarization model, task tracking model. Those were different models and way smaller, doing different things. So it's the same as agent, right? So a radiologist is gonna be picking up the call for clinical calls. There is no chance for radiologist to picking up calls for like rebooking an air ticket. So we have the same philosophy for our models. We have those clinical trade models only handling clinical calls. We also have general models to handle those like regular customer service calls.
Okay. So I think we just have another minute or two, and there are other questions that we spoke about, but happy to open it to the group if there's a question someone wants to ask. Don't be shy.
Yes, good question. So a little bit background about myself. Before I started Birch, I spent 2 years at Facebook AI research as the second hire in Seattle office. I led Robota, BART, and BART. I know how much money I spent there, like several $1 million for training those data. Those were the foundation models. I know like how hard it is for startup to doing that. I was able to get 4,000 GPUs and training Robota for 5 days. That's impossible for Birch. So, but we have trade-offs. We have time. So our fundamental models were running on 20 GPUs for several months. So the trade-off is time. We know what we want from day one. And then we design the routine for this carefully. So we don't really burning money, unnecessary money. Our goal is clear set, and we are really focused on this. Any other questions?
For summarization in particular, do you notice that there's any sort of hallucination, or is that a problem that you've tried to address? Because that's traditionally in summarization, it's one of the biggest problems.
This is definitely the question I want to hear. So GPT-3 has two big problems. All the generative models had those big problems. One is truncation. So GPT-3 can only take up to 4,000 tokens, which is 8 to 10 minutes calls. But we have 2 hours long calls. So this is the problem one. And the second problem is hallucination. So for example, one really hot startup called Character AI, which is founded by one of my friends. So on their page, the first sentence is, don't trust what model says, because there are hallucinations. So hallucination is not a problem if you do critical writing, but hallucination is a big problem if we want to document what happened in the call. So we have a new architecture which in between of extractive model and generative model. So the problem with extractive model is it's phrases, it's not complete fluent English. So we have solved this problem. It takes us a lot of effort to have really new architecture to generate things only happen during the call with fluent and complete English sentences.
That's very interesting. And what sequence length are you using in order to handle the first problem you were talking about?
Arbitrary length.
Oh, wow. Okay,
Yeah.
very interesting. Thank you.
Positional embedding is not a problem for us. Go ahead.
So is this the hard part? You've done healthcare, so the rest of the world easy? Travel and call center or about my vacuum cleaner, is that all easy? You have to develop a modification of your application.
So the daily conversations, this go back to our internal foundation models. So think internet is an ocean. It has all kinds of fishes. So what we need to do is we just need to build a pipeline to get the fish type, which is similar, if not exactly the same, as the one we want. So those customer service calls, for example, travels, airline, retail, actually that's very easier to be found on the internet. So we were able to find our basic foundation models based on those data, train on those data. For those calls, it's really hard to get from internet. So we need special labels, and also sometimes we need train on customers' data for a few hundred to few thousand samples. So I have to say this is hard based on the data part, but architecture part, they are similar.
I think that's all the time we have. Yinhan, we can hang out a little bit afterwards in the networking session so we can answer some more questions. Thank you, everybody. Thank you, Yinhan. Good job.